Hello, and today I would like to share a case with everybody that will make my case for the belief that most implants should be placed guided, whether being done by a general dentist or a specialist. This lovely lady came to our office and she presented with an implant in site number 5 and already missing tooth number 4 and 5. She had to be missing number 5 to get an implant there, but nonetheless. So she comes in, and obviously she has quite a few things going on. She's unhappy with her smile, and she wants to get her health in order, and we'll look at things. And one of her main initial concerns is she wants to get things healthy, gum-wise, but she also wants to not to be embarrassed to smile by having this big missing space in the upper right-hand side. So I dove in a little bit deeper, trying to understand what the problem was here, or what happened, and what we came to find out was that she needed to have tooth number 4 and 5 removed. They were removed and socket preserved, and then the plan was to place 2 implants in site number 4 and number 5. And according to the patient, and again, remember that's always one side of the story, but according to the patient, the surgeon in this case placed an implant in site number 4 and then made the decision that based on her bone conditions that she didn't have enough space to have a second implant placed in site number 5. And then they made a decision to at that point place 2 teeth on 1 implant, or make a cantilever from tooth number 4 with implant with a cantilever to replace number 5. Um, I don't know why the patient ended up in our office after this, but this has been some period of time. And then she ended up in our office through a referral by somebody else, and she wanted to know if I would be if I would be willing to restore her tooth. At which point I let her know that unfortunately, um, given her age, being relatively young, and all the things going on in her mouth, I did not prefer to make a cantilever to replace 2 premolars with a single implant. So my point in bringing this up is I want to do is take a closer look at this particular case. So here's her scan, and as you can see here, um, we can see the problem here. So one of the first problems that we have is how are we going to restore tooth number 4? As you can see, this implant is angled to the distal. So what this is going to require is some adjustment to tooth number 3, an impression to make it to allow an impression coping to fit, to have enough room to get impression material around it, fabricate a custom abutment, and a cemented crown. Now, that in of itself is not that bad or big of a deal. The bigger problem becomes is the offloading angulation, or offloading from this implant. So then, that's one issue. So we're dealt with what we dealt with. So the next step is let's make a plan for the implant in site number 5. And when we plan this implant out, let me do something here real quick. When we plan this implant out, we plan the implant for site number 5. What we know is that in implant to implant space, we need to have 3 millimeters. And implant to tooth, we need to have 1.5 to 2 millimeters of space. So the issue becomes in this particular case is how do we gain 3 millimeters of space between here? Basically, we can't. Now, we can get this implant into the site, but the bigger question will be, will we have to place this implant too close to this tooth? Okay, and I have my safety box set at 1.5. So now we have 1.5 millimeters away from the adjacent tooth number 6. Now we only have 1.5 millimeters of space between the implant in site number 5 and the existing implant in site number 4. And what this can lead to is bone loss in between the implants. And what that bone loss will lead to is papilla loss, tissue loss, which can then also affect the hygiene and long-term stability of both these implants. So what I wanted to do was also go ahead and use this data to understand if she truly didn't have enough space for two implants. So we went ahead and made a plan for ideal if we would have two implants here. So and this is my initial plan of this. And here we go. We could quite nicely, we might require a little bit of a sinus lift here, but we could get two nice implants in this site, no problem whatsoever. Okay, we could get two implants in here, no problem. So there we go. So if this case had been done utilizing guided surgery, certainly we could have gotten two implants here. We wouldn't be in the position that we're in now, having to come up with a story to help cover for what was done in the past, or having to consider taking out this existing implant in site number 4. So hopefully this will go to show the importance of good planning, good communication with our patients, and the use of modern technologies when we have that much space, because this would have avoided what has become an uncomfortable situation. So thank you for your time, and I appreciate it.